Hi, I'm Hergenroeder. I'm the Baylor College of Medicine Leadership Education and Adolescent Health LEA Program Director. And I've been asked to make a few comments about the effect of the MCHB-funded LEA program on me professionally, as well as our program here at Baylor College of Medicine and Texas Children's Hospital. So it starts in 1997 when we received the first funding for the LEA program. And since that time, it's had a profound effect in many ways. For example, we've had 123 long-term trainees, 12 of those in psychology, 27 in social work, 37 in nutrition, 18 in nursing, 16 in medicine, and 14 in public health, who have gone on to leadership positions in 13 states. So let me give you an example. One of our first nutrition trainees became the first dietitian for the U.S. Rice Council. After that, she moved this position to become the Director of Continuing Education for the 71,000-member American Dietetic Association. One of our former fellows has become an Assistant Director of Nursing at Texas Children's Hospital, recently completed a year as the President of the Houston Organization of Nurse Executives, and she was named one of Houston's top 10 nurses by the Texas Nurses Association. One of our psychology LEA alumni, has gone on to become the training director for an APA accredited internship program. And for those of you who'd like to get some more information, we have 3 blogs that have been produced by 3 of our trainees in addition to these trainees that I've mentioned, and it's on the MCHB 75th anniversary blog. So if you go there, you can see more detail about 3 of our other alumni. And not only have our training alumni, our LEA fellow alumni, gone on to leadership positions, but our faculty have as well. And we're particularly proud of our relationship with Dr. Wendy Adam, who was our social work faculty here for 12 years at Baylor, and has now become the training director at the MCHB's training branch. So we're thrilled about her emergence as a national leader and thankful for the effect that she's had on the development of our leadership training program here at Baylor. So the effect on training leaders has been significant. We've also had a significant effect on workforce, and specifically the pediatric workforce. We have trained 700 pediatricians over this period of time who took a 1-month rotation in adolescent medicine. But the key there is that the rotation was taught by interdisciplinary faculty. So they had an opportunity when we discussed case conferences, we had research conferences where they met with the psychology faculty and the nutrition faculty and nursing and social work and psychology. And it's not just that we talk about interdisciplinary training, they saw it in action. They were part of it. They saw what an interdisciplinary team worked like. So we had very complex cases that we see, but we use that as our ability to teach how an interdisciplinary team works. So in the clinical context, we really modeled interdisciplinary cooperation for achieving the standard of care. And that carries over to our research activities. Many of our faculty are doing research together. It carries over to teaching. So the courses within our LEA curriculum are co-facilitated by faculty of different disciplines, medicine and nutrition, or psychology and medicine. The carryover also exists to the evaluation of the fellows. All the fellows are evaluated by the interdisciplinary faculty, so they may see them in a research venue or at a clinical venue or an administrative venue, but the faculty sit down and regularly give input to the evaluation of those fellows. And then in the summertime, every year we reevaluate our curriculum, and that is an interdisciplinary process where we have a retreat, we block off time, and every faculty has input into any aspect of the curriculum that they feel needs to be improved or recognize those things that we're doing well, highlights and keeps those. The effect of the LEA program here at Texas Children's and Baylor on adolescent medicine here has been profound. And what I mean by that was once it was recognized in '97 by the administration that the LEA program was a marquee program, the department and the hospital were willing to invest in us. So we were a relatively small section when we started with 4 faculty members, and now we've grown to 14. Related to that growth in faculty, we've had a remarkable growth in our ability to procure grants, and so we've had $6.6 million in extramural funding for research and demonstration grants, which has allowed us to answer basic research questions and contribute to the peer review literature regarding the nation's adolescent health. Our technical assistance has been increased dramatically. So since 1997, we've been able to do direct technical assistance in 22 states. We simply would not have been able to do this without the LEA program and its support. And one of the technical assistance activities that we're most proud of is the Transition Conference. That is, in 2010, this will be the 11th annual Chronic Illness and Disability Transition from Pediatric-Based Care to Adult-Based Care Conference will be held here in Houston. It's now recognized internationally, so we have, the conference is going to be held in a couple of days. We have audience members from New Zealand and Canada and across 15 states in the United States. So we're very pleased about that outcome and its ability to affect a very key MCHB constituency. We worked very closely with the Title VI, or the Region 6 LEND directors, so we put together through needs assessment the best way we thought we can serve the MCHB constituency. So what's resulted is a very dynamic input between audience and faculty. Faculty include family members and youth with disabilities and chronic illness, as well as those from professional capacities in each of the 5 disciplines. So we're really pleased with that conference and its outcome. Again, sponsored by Maternal Child Health Bureau. We wouldn't have been able to do this without the Bureau's support. And finally, with respect to that conference, we will be video conferencing this to 4 other sites for the first time. And if this pilot works well, we anticipate being able to have a webcast next year. We'll be able to have this transition conference go out to a much broader audience nationwide. So what's been the effect of the MCHB-funded LEA program on Baylor College of Medicine's adolescent medicine, adolescent health program, and Texas Children's Hospital? It's been profound. From a point of view of infrastructure building, from the point of view of leadership training, technical assistance, continuing education, the program's effect has been profound, and we really appreciate the MCHB's support during this period of time. Thank you very much.